Ear infection in babies and toddlers are extremely common. In fact, according to the National Institutes of Health, 5 out of 6 children will experience an ear infection before their 3rd birthday. Many parents are concerned that an ear infection will affect their child's hearing irreversibly, or that an ear infection will go undetected and untreated. The good news is that most ear infections go away on their own, and those that don't are typically easy to treat. Baby spa. Childhood ear infection explained. The most common type of ear infection is otitis media, which results when fluid builds up behind the eardrum and part of the middle ear become infected and swollen. If your child has a sore throat, cold, or an upper respiratory infection, bacteria can spread to the middle ear through the eustachian tubes. Children are more likely to suffer from ear infections than adults for 2 reasons. Their immune systems are underdeveloped and less equipped to fight off infections. Their eustachian tubes are smaller and more horizontal, which makes it more difficult for fluid to drain out of the ear. In some cases, fluid remains trapped in the middle ear for a long time or results repeatedly even when there is no infection. Ear infection signs and symptoms. When your child can't say "my ear hurts," the following signs suggest an ear infection could be the culprit: tugging or pulling the ear, crying and irritability, difficulty sleeping, fever, especially in younger children, fluid draining from the ear, loss of balance, difficulty hearing or responding to auditory cues. Signs that require immediate attention include high fever, severe pain, or bloody or pus-like discharge from the ears. Ear infection treatments. Most ear infections go away without treatment. In some cases, infection affects your baby's health. Treating an infection with antibiotics may cause the bacteria causing the infection to become resistant to those antibiotics, and that makes treating future infections more difficult. Your best bet is to work with your child's healthcare provider to determine the appropriate course of action. Ear infection prevention. There are several steps you can take to reduce your child's risk of developing ear infections, including vaccinate your child up to date and get fewer infections than unvaccinated babies. Consider breastfeeding to reduce the risk of ear infection and other ailments. Washing your hands frequently is the best way to protect your child against cold and flu. Don't allow your child to spend time with children or adults who are sick. Children who are exposed to second-hand smoke are up to 3 times more likely to develop ear infections, so prevent them from second-hand smoke. Whether your child has ear infections or not, it's important to ensure they are able to hear well. No child is too young to have a hearing test. We use a variety of techniques to test infant hearing, and we can identify a hearing problem even in newborns.